on the broadcast with more updates. Now, an alarming COVID surge has been reported in India's major cities. 27 new cases have been ascertained, increasing the total number of the active cases of COVID-19 to 363. Remember viewers, COVID-19 cases have been going up in the parts of India. The spike in the case has prompted states to start the preparations for the availability of beds, oxygen, medicine, vaccines and to tackle any further surge in infections as well. Among the states and the UTs that have reported the cases are Kerala, Tamil Nadu, Maharashtra, Karnataka and Delhi. Now, as per sources, what we have learned that the center has taken a stock of this growing spike of the COVID-19 cases. Meanwhile, there are 2 deaths that have been reported in the past 24 hours. Arzu is joining me live in the broadcast. Arzu, COVID cases have been reported in many states. 2 deaths have also been confirmed in the past 24 hours. The center has taken stock of this transmission once again and said that all the respective departments are on their mission to also do the testing and follow up with the transmission of the COVID-19 cases. What are you picking up as far as the center's confirmation and taking stock of the numbers that we are tracing from different states is concerned?
Well, definitely, Simran, the state that have reported new infections of the COVID-19 includes Kerala, Tamil Nadu, Maharashtra, Karnataka, and also the national capital. And the concern about the rise in the COVID-19 cases increases as a lot of states are now witnessing the COVID-19 cases and the patients are increasing. And these regions have seen a marginal uptick in COVID-19 positivity rates over the past few days, prompting increase in the surveillance and also the testing measures by the local health department. Tragically, 2 deaths attributed to COVID-19 were also reported during the same 24-hour period. And the patients were underlying the health condition, emphasizing the need to be continuous surveillance and also particularly among a vulnerable population. Also, medical experts are urging the public not to lower their guards, especially in areas where clusters have been observed. While most of the new cases are reportedly mild and a precautionary hospitalization has been advised in select cases based on the age. The health ministry has in fact advised state government to ensure the robust testing, also enforce there should be a proper surveillance, proper preparation in the hospitals, and continue with the public health messaging about masking, vaccination, and also the booster coverage. And citizens are advised to avoid complacency and continue practicing COVID-19 appropriate behavior to prevent any potential resurgence of the large scale outbreak. So there has been a guidelines that have been issued, and also there has been a statewide advisory that has been issued, and people are advised to take precautionary measures so that there should not be an outburst of the COVID-19 cases. As we can clearly see, the number of cases are continuously increasing in India. Yes.
All right, Arzu. I'll request you to kindly stay on with us on the broadcast, as what we are learning further is that more updates are coming in, as 8 cases have been reported in Maharashtra's Thane and 5 in Rajasthan and Karnataka, 3 each in Uttarakhand, Haryana, and 2 in Indore, Madhya Pradesh, and 1 in Uttar Pradesh's Noida. Arzu, the number of the cases that have been reported from separate states and the cities is up, while the transmission is slowly increasing. There is also renewed worry among the people and among, in fact, the sensitive and the most affected and vulnerable groups as well. Arzu, what is your, in fact, picking up of the situation that's breaking out in Uttar Pradesh as well, which is the nearest to the national capital, where the cases are also reported, and after the cases have been reported, in the latest 2 deaths have also been confirmed, so that remains to be also a worrying issue.
Well, definitely, it's a concerning matter because in the past few months there were no cases of COVID-19, but now, as you can see, in the past few days, the number of COVID-19 cases are increasing, and in fact, there has been two deaths that have been reported, and health authorities reported 27 new COVID-19 cases in the region over the past 24 hours, pushing the total number of active patients to 363, and this makes a notable uptick in the infections compared to the recent days and indicating a potential surge in the COVID-19 cases. According to the official also, most of the newly detected cases are either mild or the patients have advised home isolation where applicable. So there are advisory that has been issued. Also, if we talk about the number of cases, there are a lot of states that are reporting, like if we talk about Maharashtra, the most number of cases of COVID-19 cases have been reported in Maharashtra, the 8 COVID-19 cases in Thane. And also, if we talk about Rajasthan and Karnataka, 5 cases have been reported in each in Rajasthan and Karnataka. Also in Uttarakhand and Haryana, 3 cases are reported. In Madhya Pradesh, 2 cases are reported in Indore, and in Uttar Pradesh, as you also said, which is near the national capital, reported 1 case in Noida. So there are a lot of cases, not in a one state, but in majorly in all the states. There are cases of the COVID-19 that are coming, which is raising the concern. In fact, there has been a high alert in the hospitals also, and hospitals are also advised to ramp up the preparations. Also, keep everything on on point. The preparation should be made in case of any emergency or any surge in the COVID-19 cases.
All
Yes.
right, Azu. Thank you very much for more updates.